Alrighty, hi guys, my name is Jared Bell, and today I'm talking about my research project. I've been studying all semester. The topic I chose was treatment regiments that play a overall role in functionality of the shoulder girdle. As far as my research question goes, I looked into how does a loss of rotational range of motion affect athletes, leading to potential shoulder injuries. A little bit of background: I played baseball all my life, over 18 years now. The shoulder has always been an interest to me. I've seen firsthand many teammates and players have made common injuries a countless number of times. This is another reason why PT has always been a career path that I wanted to pursue. I've always wanted to be able to strengthen people not only mentally but physically, help their muscles gain strength and become a better overall quality of life as well. I also was able to work in PT clinic these last couple summers as an aide. I was able to see firsthand a lot of upper extremity injuries as well. A little medical terminology we need to know: range of motion, which is just abbreviated as ROM, open and kinetic chain exercises, which we'll be talking about later. Those are abbreviated as CKC and OKC. And there's a few muscles there we need to note: serratus anterior, lower trap, middle trap, posterior deltoid. Kind of what we'll be talking about most today. For effects of loss of range of motion, we see here there's three common ways to measure range of motion. We have total range of motion, external, and internal range of motion. Those are kind of the basic three. Measuring rotational range of motion is always done with a goniometer and should be taken with the measurement of the glenohumeral joint, which is the movement of the arm distally. In a study you've seen here done by Alan Becker, he measures glenohumeral joint total rotational range of motion in elite tennis and baseball players. It showed that in both groups, athletes, total rotational range of motion was greater in the non-dominant arm than the dominant arm. As well, in another study, we see here we looked at the scapula stabilized, and we found that internal, external, and total rotational motion were significantly affected. This is important because clinicians and PTs should be worried about not only measuring the range of motion, but they should be looking at not only unilaterally but bilaterally to be able to tell if one side is lacking more than the other. As well, we can look at not only in injured athletes but in healthy athletes as well to be able to predispose injury before it happens. For rehabilitation recovery, scientists found that to be greater overall activity level during close kinetic chain exercises, which is when your distal part of your limb is on a fixed position. So here in this photo we have the leg, it's not the arm, but the leg is fixed on the ground. That's the same with like a weight. If you have a weight bearing exercise in your arm and you have the weight distally, that would be a closed kinetic chain exercise. And they found that closed kinetic chain exercises showed that the muscle showed an increase in overall muscle activity, which is good for after injuries or tears or even surgery, because you want to have more hypertrophy, not atrophy, in the supraspinatus, infraspinatus, and the anterior deltoid. As well, close kinetic chain exercises allowed for reduced muscle fatigue and overall muscle recruitment, like I mentioned a second ago. For the exercises we see here, these are the four common for strengthening the shoulder muscles around the shoulder girdle. We have forward side lying position, we have side lying external rotation, horizontal abduction with the external rotation, and prone extension as well. As far as the results, we see here that in A, B, and C were optimal for not only upper and lower trap imbalances, as well as A, B, C, and D were huge for upper trap and middle trap imbalances as well. Based on the results, we can see that side lying external rotation, side lying forward flexion, prone horizontal abduction with external rotation, prone extension are the best for helping treat scapular muscle imbalances. For rehabilitation and recovery, we see that the most common shoulder strengthening exercises was found in A, B, and C. As well, we need to be able to be more aware of training muscular where they were at previously. When you're training patients, all patients are different. We need to be aware of physiological differences. Multiple studies shown that not only children had a greater range of motion but females had a greater range of motion as well. We need to be able to understand that when we're dealing with patients and muscles that looking at not just one specific muscle, but looking at the group, especially the shoulder girdle, that it all functions as one is very important as well. Here are the references, and any questions?